And now on the line is Paula Leonard. Paula is the National Lead with Community Action on Alcohol, or the ICAAN network with Alcohol Forum Ireland. Paula, welcome back to Near FM.
Good afternoon, Darren. Thank you.
Okay, Paula, today is only my second time to interview you. Our last interview was just over 4 years ago. I got in touch with you on Monday of this week to schedule this interview, as there was a big article in the Irish Examiner recently about the alcohol industry funded Drinkaware organisation, and you were quoted in that article. Before we talk more about the story in the Examiner a few days ago, Paula, could you remind our listeners a bit more about who the Alcohol Forum are and what separates you from the organisation Alcohol Action Ireland?
Oh, well, we would share very similar goals to Alcohol Action Ireland, and in particular on this campaign in relation to Drinkaware, we would share very similar positions. But Alcohol Forum Ireland is sort of a grassroots organisation. We do provide a whole range of supports and services for families who are impacted by a loved one's drinking or other drug consumption. Some of our programs now also deal with gambling. We have 3 offices, so mostly in the northwest of the border region. So we have one in Cavan that serves Cavan Monaghan, we have one in Donegal, and we have one in Sligo. But at a national level, we have, an advocacy role, and also my own role supports at a national level community action on alcohol, working with local and regional drug and alcohol task forces. So I suppose, there's lots of room. There's so much alcohol harm in this country that it's really important that, everybody is collaborating and everybody is supporting each other's work. And for us, that work with families, with communities is central to the way that we operate. And all of our advocacy is based on that.
Okay, your head office is in Letterkenny, isn't it?
It is, yeah.
Okay, cool. Okay, we'll move on to the main reason I got in touch with you to do this interview today. Since I spoke to you on Monday to schedule this interview, Paula, there was a very big development in this story. To go back to the start of the story, can you tell me what is your problem in the Alcohol Forum Ireland with the organisation Drinkaware?
I suppose just to be really clear, it's not just our issue. The vast majority of public health evidence and the vast majority of public health experts at a global level, including 300 who wrote to the World Health Organization a number of years ago, was that the drinks industry and drinks industry funded charities and social aspects organizations should not be involved in a number of areas. And those areas are education, prevention, and the delivery of public health advice relating to alcohol. So that position is very clear in the new WHO European framework on reducing alcohol harm. And we are absolutely delighted that that position is now being supported by the Taoiseach, we have cross-party support for that now. It was raised in Taoiseach's questions by Sinn Féin yesterday, and again the Taoiseach reiterated his position that Drinkaware should not be involved in the delivery of schools-based education. Roisin Shortall from the Social Democrats was the person who, cracked open the debate at a public level, because on a request she raised a parliamentary question in September, and we now have Senator Mary Siri Kearney of Fine Gael raising it this morning in the Seanad. So the ball is very much rolling on this. Momentum is gathering. We have a petition that people are free to sign up on change.org if they feel as parents or as citizens that they feel that it's past time and we no longer should have an organisation that is funded and has close funding links to, the suppliers, the producers and the retailers of alcohol. They shouldn't be involved in the education of children in Irish schools. And what we've heard very strongly this week, actually, from various different places, is that, number one, parents were not aware that this programme had close funding links to the drinks industry. And the parents felt they should have been told. 15,000 Irish students have been through this programme, at least. Those are the official figures that we know of. And really, It's great that I'm on the radio with you now. It's great that there's a national debate, that it's been raised in the Dáil and the Seanad, that the Department of Health have responded on this and said it's not a welcome thing to have, this programme in our schools. The HSE has been very clear on that. And it's very questionable how long Drinkaware can, maintain their position that they have a legitimate right to be involved in the education of our children.
I've never interviewed them myself, but occasionally other journalists over the years in Near FM have done interviews with their spokespeople. Okay, Paula, I know you've just kind of answered this, but what would you say to the argument that the area of public health and alcohol awareness is a huge area and is not very developed as per public health alcohol advocates? So, like, Drinkaware would say there is a space for an organisation like them in Ireland and around the world today. What would you say to that?
Look, that is the argument that has been made. I want to make just a couple of things clear. Schools-based education and prevention on its own in reducing or preventing youth alcohol consumption is fairly low on the table of evidence in terms of what works. Okay? So it needs to be part of a whole society approach. I'm not saying it doesn't have a place, but it has a place in a pecking order, and it should be part of a suite of measures. So, for example, which wasn't supported by Drinkaware, the Public Health Alcohol Act. And we know in this country that the drinks industry and its interests and those lobbyists working on behalf of the drinks industry lobbied hard and long to make sure that the Public Health Alcohol Act was not implemented in this country, which looked at the price of alcohol, which looked at the availability of alcohol, and which looked at the exposure of young people to alcohol marketing and alcohol advertising. Those are the things that we know will give us the best bounce in terms of protecting children and reducing alcohol harm in this country. Schools-based education and prevention programs have a place, and our position is very clearly that the HSE, the Department of Health and the Department of Education need to show leadership on that. We already have the senior cycle programme, Know the Score, delivered through schools, and we are being told very clearly that the HSE junior cycle programme will be shortly ready. Now, Drinkaware have argued that they were filling a gap. The question to them, and I'm very clearly asking them this morning in your show, is when that gap is closed, when that gap is filled by the HSE, who will soon have this programme ready, will they then change their position and leave Irish schools, where we don't see, and public health advocates do not see, that they have a place. They have no place being involved in the education of our children. So, that's sort of where we're coming from on this. We acknowledged, that there's a role for education, but it's not their role. The World Health Organization, as I have said, is very clear on that, and all of public health experts, community globally would say they shouldn't be involved in education. It's time for them to go.
I looked at their website yesterday and I didn't see it. Well, there could have been a link, but I didn't see it. There wasn't a prominent link anyway to anything about the Public Health Alcohol Act. On their website, I saw a press release or statement by them released at the beginning of this week. I think it was before Micheál Martin spoke out on this issue, but the statement started with the words, with a sentence: Drinkaware is a national independent charity working to prevent and reduce alcohol misuse and delay the age of forced drink in Ireland. Paula, if Drinkaware are correct in that is their job as the national independent charity in this area, I have to ask, what do you think that makes yourselves in the Alcohol Forum and Alcohol Action Ireland?
I think that's a very good question. First of all, I would query the use of the word independent charity. They have an independent board of directors, they have charitable status. All of those are things, that they can point to and argue for in relation to their legitimacy. But they are not independent in the sense that they have close funding ties to the alcohol industry. Alcohol Action Ireland and Alcohol Forum Ireland in no way, shape or form accept funding from the alcohol industry. And the reason that we don't do that in Alcohol Forum Ireland, and I can't speak for Alcohol Action Ireland, but I do know their position is very clear on this. We do not accept funding. we will not accept funding, and we think that there is an absolute inherent conflict of interest when it comes to organisations who are in receipt of funding from the alcohol industry. What we do know, for example, is when the Drinkaware in England schools-based programme was evaluated, that there was a robust, peer-reviewed journal article on that. And what that evaluation found is that, in fact, those materials normalised alcohol as a normal everyday a normal everyday thing for adults to engage in, that it contained, positive imagery of alcohol in the pack, and also that it included some nudges to drinking. We haven't seen the pack. The pack is not available for the Irish iteration of that programme. It has not been shared publicly. The 15,000 students, their parents haven't seen it. Were schools aware that Drinkaware was funded by the alcohol industry? That also is questionable. And if they were they consciously aware of the risks associated with that? So I think that we're in a very different place right now. I don't think that schools anymore can either not know about it or can claim to not know about it. And that really, we're in a very different place in terms of a population of people who now know and understand that there is a risk associated with this, and there's a growing demand for change.
Okay, Paula, I saw a tweet by Roisin Shorehall on this matter a couple of days ago, and as you said, she spoke out very strongly all over the last week on this issue. But I imagine that it is not likely that Micheál Martin's words on Monday will be the end of this story, i.e. I imagine that there will be more movement on the issue of Drinkaware and our schools. What do you want to see happening next with this story about Drinkaware, Paula?
Well, I think, the Taoiseach has also spoken at length yesterday, and he said he has spoken now to the Department of Health and to the HSE, and he is asking them that they make it more clear with schools and that they communicate with schools across the country that this programme shouldn't be delivered in Irish schools. That's what his position was of yesterday. So he has strengthened the position that he articulated earlier in the week. So I think that does need to happen. I think that's a really welcome statement from the Taoiseach Micheál Martin. We're delighted with that. In the Seanad this morning, Senator Mary Siri Kearney has asked for a debate an official debate in relation to who is delivering alcohol education in our schools, what the programmes are, making those programmes available so that they can be robustly evaluated and critically assessed. And that also needs to happen. So if we have that debate at Janet level, we have, the department and the HSE being instructed to communicate with all schools. That's all really welcome, and we're really happy with that. The end game, where we would like to see this going, is we want to see evidence-based, independent education provided in our schools by, those who are tasked to do that. So the HSE, the Department of Health and the Department of Education, those programmes and, the development of policies, for example, on the use of alcohol and other substances in school, and some work around the delivery of the training, that can be supported at the local levels by regional and local drug and alcohol task forces. So there are plenty of resources out there. There is a good support infrastructure there at the local level, and there's no need for this programme to be delivered by an organisation funded by the drinks industry.